I'm here with Dr. John Halamka, who's just delivered the James Reed Memorial Lecture at the SNOMED Expo 2016 here in Wellington. John, a fascinating talk. You covered a wide range of topics. I just want to ask you, you talked about the difficulties around interoperability melting away. I think melting away was the word you used. You also mentioned that when you started working with standards, you were promised that it would be 8 hours a year. It became 8 hours a day. I'm just going to ask you, do you think we're at a point where we have enough standards that we can just get on and use mobile, use cloud to make real change?
So I do, and I really believe we're at a tipping point. It's what I would call the perfect storm for innovation. What you need is alignment of technology, psychology, and political will. And so what do we have? We have transport standards, REST, HTTPS. We have vocabulary standards, SNOMED, CT. We have content standards. We have this idea as a society that unless we exchange data for clinical care, we will not be able to deliver on the promise of better quality, lower cost. And we have urgency. I see every economy across the world running to the edge of its economic capability to fund what are aging societies and lower birth rates. So what a perfect opportunity. Obama's chief of staff, Rahm Emanuel, said, "Let no urgency go unused." So sometimes a good crisis is what you need. So economic challenge, a great opportunity to change.
In New Zealand, we have a concept called social investment, which is that our knowledge, with a better knowledge of our population, we can target the individuals most in need who are going to have a greater lifetime burden if we don't intervene earlier. Do you have any thoughts on how we might address that? In your speech, you talked about how individuals are empowered with mobile technology, but that is sometimes perceived as people who have the capacity to act for themselves, but the others who maybe are less so are probably the people that we're targeting with our social investment approach. Do you have any thoughts?
Sure. So what is health? Health is much more than what meds are you on, what problems do you have. It's where do you live? Do you feel safe? Has there been a history of child abuse, right? So you really need to look at clinical data, financial data, social determinants of health, where possible, objective data from the home that the patients and family provides. And you need to look at the wealth of social services offered to a family, and it's that whole constellation that equals outcomes of wellness. And at Beth Israel Deaconess, for example, we have over 30 social determinants of health recorded in the electronic health record. In Massachusetts, we take Department of Child and Families data on child abuse and interventions in the home, mix that with Medicaid, wellness programs, clinical and financial data, so that social services really see the whole picture. And I think New Zealand is uniquely capable of doing this at a country level, because unlike the United States, you are actually aligned as a people.
Historically, we have used SNOMED to capture information about medical conditions, medications, interventions. There seems to be, in some of the things you said today, a need to capture more about the context you were just talking about. Is SNOMED the right tool to use to capture that wider context of health and social information?
So we see in the United States, we created something called the Value Set Authority Center, which is, we use SNOMED as the core. And if there are other vocabularies you need, like the LOINC vocabulary, you map it back to SNOMED. So in effect, the government provides a single toolkit for all the various controlled vocabulary data sets you need, and absolutely, SNOMED is the centerpiece.
I've got a question about the knowledge bases that we're creating around the world with our the greater volume of data available to us. Are those knowledge bases things that you would see people will seek to monetize, or can we expect them to be in the commons? What's your view?
This is, of course, a very tricky issue, which is probably the answer is both, which is if a company creates an innovative data visualization that allows you to turn data into wisdom and action, probably they could charge a subscription fee for that. So we've tried to make state government data available in an open source fashion for the benefit of all society, but then also allowed innovators to layer on top of that innovative apps.
New Zealand is making a major commitment to SNOMED, and I think you talked about SNOMED everywhere, that's a given. We're not going to be out on a limb doing this, the rest of the world is following.
So the United States has adopted SNOMED as a requirement. Every doctor must record every structured data observation with SNOMED. So you got 330 million people on your side, and this is my 20th day of travel. I have been all over Europe, all over Asia, every country I go to. SNOMED is the vocabulary of choice. You're good.
Dr. Halamka, one last question. You're going to embark on a 23-hour journey back to your home in Boston shortly.
Right.
You tell us that primed for your Geek Doctor blog, you have a piece on why New Zealand will lead the world.
Right.
Can you give us a scoop preview on that just now before you embark on your trip?
So over the last 3 days, I've met with deputy prime ministers and health ministers and director generals. You have amazing people with total alignment of vision. Find in the United States government alignment on anything. At this point in history, we don't have it. So you've got SNOMED CT, alignment of vision, you've got government willing to enable. This is the perfect storm, so New Zealand can lead the world.
Thank you very much, Dr. Halamka. I wish you a good trip home.
Well, thank you. Absolutely.